Here are 35 fascinating facts about white blood cells, WBCs, the tiny but mighty defenders of your body. White blood cells are also called leukocytes. They are a crucial part of your immune system, defending against infections. There are 5 main types: neutrophils, lymphocytes, monocytes, eosinophils, and basophils. They make up less than 1% of your total blood volume. Despite being fewer in number than red blood cells, they are far more complex in function. White blood cells are produced in your bone marrow. They can also be made in the lymph nodes, spleen, and thymus. The average human has about 4,000 to 11,000 WBCs per microliter of blood. Their numbers increase dramatically during an infection. This is called leukocytosis. A low white blood cell count is called leukopenia. Neutrophils are the most common type of white blood cell, making up about 50 to 70% of the total. Neutrophils are the body's first responders to bacterial infection. Lymphocytes are vital for long-term immunity and include B cells and T cells. B cells produce antibodies to attack specific invaders. T cells destroy infected or cancerous cells. Monocytes become macrophages that engulf and digest pathogens and debris. Eosinophils are specialized for fighting parasites and play a role in allergies. Basophils release histamine during allergic reactions. White blood cells can move on their own by squeezing between cells, a process called dipedesis. They can sense chemical signals released by damaged cells to locate infections, chemotaxis. WBCs can survive from a few hours to years, depending on their type. Memory lymphocytes can live for decades, providing long-term protection. Stress can temporarily lower white blood cell counts. Exercise can briefly increase WBC circulation. Smoking can reduce the efficiency of white blood cells. Certain diseases, like leukemia, cause abnormal production of WBCs. Fever is often a result of WBC activity in chemical signals like pyrogens. White blood cells can eat bacteria, a process called phagocytosis. They play a major role in inflammation, which helps isolate infections. Some pathogens, like HIV, specifically target WBCs to weaken the immune system. Chemotherapy often lowers WBC counts, increasing infection risk. WBCs are constantly patrolling your bloodstream and tissues for invaders. Some WBCs release enzymes that break down bacterial walls. Overactive WBCs can cause autoimmune diseases, attacking healthy tissue. Without white blood cells, even a minor infection could become life-threatening.